inviting Suzan for Alport, United Kingdom, to give a presentation about that will be the report from the last Alport meeting in Beijing. It was a huge meeting, a lot of participants, a lot of news. Let's hear what happened in Beijing.
Thank you very much, Venerable, and thank you to yourself and to Gordana for the wonderful invitation. It's very special to be here and to join you all. For those of you who don't know me, I'm Chief Executive of Alport UK, and Alport UK runs the Alport Syndrome Alliance, which is a global network that advances treatments and knowledge for people living with Alport syndrome. My connection with Alport is that my mother was diagnosed with Alport over 50 years ago, and I was actually misdiagnosed, so I didn't think I had Alport. And I went on to have 3 lovely boys. So this is Patrick, who is a broadcast journalist, and he loves American football. And then the next one is Archie, and Archie doesn't have Alport syndrome. So Patrick actually does have Alport syndrome, and he had a kidney transplant during COVID. And Archie doesn't have Alport, but he's as affected by it because he worries about his brothers. And he swam the English Channel, so he swam from the UK to France to raise money to help his brothers, which is very special. He's a very special young man. So he's 25. And then there's Jamie, my youngest boy, and he actually went into kidney failure earlier than Patrick, aged 18, and very sadly was on kidney dialysis for a couple of years. And as a mother, that was very hard to watch. And indeed, I can tell you, your quoting of the guidelines is not quite right, because actually as mothers with Alport syndrome, so I was diagnosed with Alport syndrome, but the guidelines say that you can be considered on a case-by-case basis to donate to your child. So I went along to my kidney doctor and I said, I've been healthy all my life. I've got very poor hearing, but I've been healthy with my kidneys and I've been followed up for the last 40 years. Please, can I donate a kidney? And he said he would consider me, and he put me through all the usual tests and things, and I came out top of the class, he said, and I was allowed to donate last year. So last November, I donated a kidney laparoscopic surgery. Thoroughly recommend it. Didn't go for any pain relief because I was really worried about having NSAIDs with my Alport. But Jamie is also doing fantastically well. So he's gone back to university, and it's really special to see his progress and how he's progressing a lot quicker now. He doesn't have to dialyze 3 times a week. So I'm going to talk a little bit about the Beijing Alport meeting. So this is what the Alport Syndrome Alliance organizes. And one of the things that I wanted to do was to just make sure that, to explain to you how pivotal Beijing was as a meeting for us as a community. The person on the left is my thinking partner. So this is Professor Rachel Lennon, and she and I work very closely together, trying to anticipate new opportunities for the Alport community. We shared lots of examples of international collaborations, and I'm going to talk to you about some of the outcomes and the exciting research, and it's in addition to some of the stuff that Detlef talked about earlier. And I also want to give you an overview of the inspiring people who are working in Alport syndrome and some of the lovely patients who are also volunteering to help us, because it's thanks to all those lovely people that we've got all these exciting treatments coming through. So we always start an Alport international workshop with a video of somebody who's living with Alport syndrome. So I'm going to introduce Nathan to you. He's a 14-year-old young man living in Shanghai in China.
When I'm like 8 or 10 years old, my parents started to tell me about what is the disease I have, and I found like I didn't really know a lot deep about kidney disease, but what I know is like my kidney is not as strong as normal kidneys, so I need to protect for the kidney to last longer. I usually go to hospital once 1 to 3 months, and during these times I will talk with the doctors, and doctors will tell me how could I prevent kidney failures better, and it's really helpful for me. With the first time I went to hospital, meeting doctors was not really the most scary things. Taking blood tests, it seems like some sharp things needs to be in your skin, and it is pretty anxious for me. But after the blood test, it's really no difference than what seems before. It's just like a test to know my body more. And there's no need to fear. Most doctors know me, and there's no need to fear. They're telling me things that could really help me, and these things I need to learn from it. I don't usually tell others that I got it, but when others ask about it, if these are like students and if they are my friends, I'll probably tell about what the kidney disease is like. But if teachers or others, I will probably not tell them, because actually the kidney disease does not make a lot of effects on me. But if I tell the others will see this as a big problem and stop me from doing other things. In Singapore, I learned there's many experts giving speeches about kidney disease and which type of kidney disease am I having and what are these consequences I will be meeting at later in the age, for example, 30 years old. And I also meet a lot of patients that maybe they got even worse kidneys than me, and I learned a lot about them and how make me build a positive attitude toward the kidney disease. Now starting to play squash and improving my fitness can really help focusing on learning, and I found that squash could help me concentrate, get a better body, help my kidney, and even have more topics with my friends to discuss about. I just wanna encourage others with kidney disease, just do things like normal people. Don't let your mind affect you. Actually, your body is the same as normal people. The problem is your mind is trying to tell you that, oh, this kidney disease is very serious. You can't do this. You can't do these. But you could actually do as same as the normal people.
Lovely story, isn't it? And that was filmed by another Alport patient. So we have a wonderful Alport patient who is a filmmaker. He's an award-winning filmmaker who works with us in the UK. And if anybody is interested in sharing their story, these films are the things that inspire the pharmaceutical companies to do their science and to do their research. And this is one of the reasons that Alport is forging ahead with new treatments and pharmaceuticals involved, is because we're prepared to share our stories. So anybody who's interested, please let me know. The group up on the left is the Chinese patients who came to the Beijing workshop, and it was a really powerful time to have with everybody. So let me just take a step back and go back to the first workshop that we organised, which was in 2014, and that was in Oxford, because I was teaching at the business school at the time. I'm somebody who works in business, and I was teaching as an academic at the university. And we agreed a dual strategy for finding treatments at the time. So it was very much focused on protecting the kidneys. So as a parent with young boys, I wanted to make sure that they could get through that critical stage of university by having protective treatments that would keep their kidneys going for longer. And that would also give us time to then develop the transformative treatments, which some of the speakers were talking about earlier, the genetic therapies, etc. And building our knowledge as we progressed was really critical. In Oxford, there was very little genetic information, so we really asked the researchers to build up their understanding of the genetics of Alport syndrome, and that's one of the reasons we've progressed so far. And what's really important and unique about our workshops is that patients, clinicians, laboratory scientists all work together in the workshop, so there's equal numbers of each. We're not just a voice to have there to be a representative. We actually actively contribute to the science. Now, in Oxford in 2014, the only people that were missing was industry. So at our first international workshop, we had no industry at all. I can have to say we changed that for the next one. So if I talk, I'm not going to spend long dwelling on the Alliance itself, but this just shows some of the patient groups that are building over the world. And the two most recent are Japan and Hong Kong. So when we go to a country to run an international workshop, as part of the preparation, what we do is also develop a patient organisation at the same time. And that's absolutely critical, because if we're going to develop the research in a particular country, the patients need to be engaged in the research. So I really encourage you in Macedonia to work with Gordana on engaging in research, because it's about the future for our children and for treatments. This is just the network that we have in the UK, and we encourage each patient organisation to have their own network of registry, patient support people, connect with their own kidney association or hearing people, etc. too. Now, I just wanted to give you a very quick overview of the agenda. So we typically do our workshops in 4 days. The first day is a patient day. And that's just for us patients to meet, to get a level of understanding about Alport syndrome. And what we do is we invite the international experts to come and talk to us. So you get the experts in the world who come and share what Alport is all about. We also invite the local clinicians who don't really know that much about Alport syndrome to join that meeting, so that they get their knowledge up at the same time. And then a certain number of patients, the ones who are really interested in the science, join us for the next 3 days. So days 2, 3, and 4 are a very big deep dive into the science. And the first day here is about the inputs. So you will see the blue here is the posters. So we do quick fire posters. So the researchers have 3 minutes to present their projects. And it's a hugely exciting trot through amazing science that they're doing. And then the second day of the science meeting is a deep dive into the basic science. That's the discovery stuff that's looking down a microscope. Then you've got the genetics, and in this last workshop we particularly focused on collagen 4, alpha 3 and alpha 4, because we don't know that much about that community and how they progress. If they progress, and what percentage do progress. And then we look at the preclinical studies. So this is when there are potential new treatments and they're tested in animal models. The animal models are various. There's worms, and there's zebrafish, and there's mice, all with Alport syndrome. And they're a very important mechanism, because we can't test drugs in humans until they've been tested in animal models. One company tried to do a clinical trial, and it failed, and we didn't support it because they hadn't tested it in the animal models. And then there's clinical and registries. This is absolutely vital. So I really encourage you in your countries to support your registry, because that's how you get to capture the data about the natural history of a condition like Alport syndrome. And then the final day is about clinical trials. So this is when we hear from the pharmaceutical companies and the academics who are working on clinical trials about the latest things that they're testing and the results. And a lot of it is unpublished data, which is hugely exciting. So we have special rules where people are not allowed to publish anything that comes out of the workshop without us agreeing to it, so that people can talk openly about unpublished data. So I hope that just gives you. We also have a lot of social stuff that goes on in the evening. We've been doing these workshops for 12 years now, and the Alport family is growing, and we're becoming very good friends. So we do like to have some social time and see the country that we visit. So we do city walks, and we have gala dinners where we have some kind of cultural thing as well. And the Chinese people sang for us, and they said, "Susie, I hope you've come prepared with a song." And I said, "I'm really sorry, but singing is not my favourite thing." But actually one of our researchers, Jeff Miner, very bravely sang. I absolutely am in awe of Jeff Miner. He's one of our basic scientists, which is incredible. So an important part of the workshop is the organisations that sponsor it. So we pay for a lot of the patients to participate in the workshop. It's tough enough having Alport syndrome. We don't think that you should have to pay to come to workshops necessarily. And so what we do is we raise money from the pharmaceutical companies so that you can come and participate in the science and hear from the latest experts. What's different about this workshop is that we've got the big pharma companies like Bayer, and this Natera is a big genetic testing company in the States. And Calliditas is an organisation that's also just finished one trial and is about to start another. And what we do is we organise the workshops with the local organising committee. So in this case, it was the China Parents Association, which I helped set up about 11 years ago. And then Peking University First Hospital, who were exemplary in their organisation. The Chinese were amazing. We actually organised it the same day that Putin actually came into China for the military parade. So we had to go to about Plan G with our dialysis patients and getting them in, because Putin decreed that there was going to be a no-fly zone over Beijing, and we had to get our dialysis patients in. But Jai Ding managed to make it work, which was amazing. We also get lots of local pharmaceutical companies and sponsors as well, because it's very important for the local community to raise the profile of Alport syndrome. So in China, as I mentioned earlier, we had a third of patients, clinicians and laboratory scientists. And this time, compared with Oxford, we had 10 pharmaceutical companies represented. And 3 of them were large pharmaceutical, big multinationals. And that was a really big first for Alport, which is super exciting, because those companies are the ones that have the money to develop the therapies for rare diseases like Alport syndrome. You can see from the numbers in Oxford, just to give you a comparison, we had about 70 people. So to have 263 people registering was astounding for a rare disease. It was super exciting. And the number of patients that came, 74 from China, was incredible, because it was lovely to see their engagement. And the pharmaceutical companies were really interested by their level of engagement and questions. Now what we do is we make sure that we have as many presenters as possible, so everybody who's doing a new project in Alport presents. So we have to manage 89 presenters. Can you imagine that over 4 days? And we're all volunteers, by the way. I organised this from my kitchen table. So it was quite a task to organise, and we had 26 moderators as well. And it was simultaneous translation in Chinese and English, so that the Chinese got the full benefit of the science. This is my group of volunteers who very kindly helped. And Jane on the right-hand side with the platinum blonde hair is our paid employee, our operations director. So if any of you get an email from Jane, she is the most special person, and she's an absolute gold. Well, she's gold dust. She's just brilliant in terms of connecting us all up. Just going back, this is Jai Ding on the left. She's the amazing professor in China who leads the work. She's a pediatric kidney doctor working at Peking University First Hospital. So she was my collaborator on the agenda to make sure that we got the content angled in the right way. Now this is just to show you, oh, interesting translation here. You'll have to tell me what it says. But basically we had 72 posters from all around the world. Thank you. And this is just to show you the breadth of the research and how in Oxford, I think we had 12 projects and they weren't new projects. And these ones were all new and super exciting. So it really shows you the breadth. Africa is a big gap for us at the moment. So that's something that we're working on with colleagues in Nigeria and South Africa at the moment, and also South America too. And then also, one of the reasons we go to a country as far away as China is to engage the local clinicians in working on Alport. So we set them at the deadline of the workshop to come and present their latest research. And again, we got a lovely 9 different districts in China to contribute to the agenda. And this is a really important outcome from our workshops, to make sure that we leave a country understanding more about Alport and contributing to the science. So I just wanted to give you a flavour of some of the projects that we actually worked on in Beijing. You saw, I think Nana used the spectrum example earlier, where we've progressed it even further now. And what we're looking at is people living with Alport syndrome have symptoms and outcomes on a spectrum. So somebody like myself is very much at this mild end. My condition is so mild, I was allowed to donate a kidney. But my boys are right at this end, on the very severe end. What you don't know is also my sister has Alport syndrome, and she's in the moderate. And then I have a girl cousin who's very severe. She went into kidney failure aged 14. And what we're trying to get the researchers to help us understand is why, when a family has the same genetic variant, why do we all have different versions of it? So there is something happening with the genetics. And we also want to make sure that we make it simpler to explain to people. So Alport syndrome is obviously at the very severe end and has the syndromic features with the kidneys, the eyes and the ears. People who wear hearing aids, a bit like me. But then there's also, on this end here, the milder version. And to call it a syndrome is a very dangerous thing, because people typically don't have the syndromic features. So, for example, if there are men or women with one collagen 4 alpha 3 or alpha 4, it's very rare that they will have eye or ear complications. It's actually quite rare. Only about 3% of those people actually transition into kidney failure. So it's really quite a low percentage. So to call them Alport syndrome isn't the right thing to do. So at the moment, we're talking about Alport risk. Because if, for example, they smoked heavily, they drank a lot, they became obese, took lots of NSAIDs or whatever that causes kidney issues, they could progress. But I think it's very important for us patients to also understand that you have a very good chance of not progressing, particularly if you want to live a healthy life. And that's why we're at the moment talking about it as Alport risk in comparison to Alport syndrome. Now this is yet to be published, and we're testing people out on whether this makes sense or not. So if anybody has any views, please come and talk to me afterwards. So that's one of the projects, and Rachel Lennon is the person who's been spearheading that project. Another really important project, which contributes to discussions about clinical trials with the FDA and the EMA, is a proteinuria study. What is that? It's basically looking at the natural history. So how do Alport patients progress over time? So that when we have a drug in a clinical trial, we can compare that data with the natural history data. So we've done a fantastic collaboration out of the UK with our registry called RADAR, which is the Rare Diseases database, and my colleagues at Alport UK, and then 3 pharma companies. So our emphasis is all about collaboration. We don't like to work with just one company because one company can suddenly decide overnight that they're not going to invest in kidney research anymore. So we like to spread the risk. So we worked with 3 companies on this study, and the presentations have received huge interest. And this is work that was done by Katie Wong out of University College London. And really excitingly, we started conversations with other registries in other countries. So we're talking with Franz Schaefer about the ERCnet registry, and we hope to collaborate with a lot of countries to get European data. We're collaborating with Japan and with China, so that what you can do is you can do some meta-analyses to get more data, because the UK, after all, is a tiny little country with a few patients, but there are other countries like Japan and China with many more patients. One thing I just wanted to show the clinicians in the room, but also patients, is just a bit of data from the proteinuria study. And this was something that we hadn't really understood before. And this is just comparing how different types of Alport syndrome progress. So here you've got the X-linked Alport syndrome, the men. You've got the female X-linked Alport syndrome. You've got the heterozygous, which is collagen 4 alpha 3 and 4, and then the homozygous, where you have autosomal recessive inheritance. So these are the different types. And what we wanted to show you was that actually kidney disease tends to progress on quite a predictive journey, typically. And that makes things easy for the clinicians to actually identify as and when somebody might need a kidney transplant or dialysis. But what happens in Alport syndrome, you can see the spike on this final stage 4, here, in all of the cases, but particularly severe with the young men. And this shows that what happens is it progresses extra quickly in the final stage of kidney disease. So the important message for the clinicians is that actually for Alport syndrome patients, we need to start thinking about renal replacement therapies earlier than you might do for a kidney disease that just progresses at a slow rate. And what's also important is that the collagen 4 alpha 3 and alpha 4 heterozygotes have about 2.2 years to progress. That's an average time. So this is informing our understanding about how Alport syndrome progresses. Another project, which our colleague mentioned here, quoting the transplantation stuff, was heralded by Rosa Torra from Spain and Beata Lipska from Poland. And they're on our committee and led this really important work about the diagnosis and management. And if ever you are not able to get ACE inhibitors or not being considered for SGLT2 inhibitors as treatment options, please quote the guidelines, because they're there to help you as patients and to help you as clinicians. Another project, I think I'll skip this one because I think in the interest of time, well, it's the end of the day, isn't it? I think we need to move on quite quickly. But Becky Ma from Hong Kong is doing an amazing project. I won't go into the detail of it, but it's to lobby governments to get genetic testing more prevalent. And this is particularly in Southeast Asia, they don't have much genetic testing. Now, this is some of the exciting work that I wanted to talk you through. So this is the preclinical studies that were reported on at the workshop. Now, one of the things that's really important to understand is that as an organisation, we didn't want to just fund one type of genetic therapy. We didn't want to progress just one genetic kind, because often science comes up with a block at the end of the research. So what you need to do is to progress lots of different types of study. So what we've got here is 3 that target DNA, we've got 3 that target RNA, and these are gene options, transformative gene therapies that are in animal models. And then you've got 2 that target proteins and 1 that targets cell death, which is actually a synthesized molecule, which has some really exciting stuff. I'm not going to go into the detail of that. If people want to hear about those, I can happily tell you more about them. A lot of it is unpublished data. But the important thing for you to know is that the therapies are actually showing in the mouse models an improvement in the protein So what Detlef was talking about, how the network breaks down when you have a genetic variant, the therapies are actually showing an improvement, as Detlef showed with the ELOX example, Elexuren, which is hugely exciting. So I think we should be really proud of the progress. This is in 12 years, we've got all these different options, and they're all quite possible options that potentially could go into human studies. So very different ones, and very different ones to talk about with your doctors in the future. This one particularly is about possibly between 1 and 3 years from going into human studies. They've just got to do a few more, I think, with healthy human studies before they go to Alport patients. We produce a book which translates a lot of the science in graphics. So we have a graphic illustrator at our workshop. This is just a very quick graphic. The workshop was a couple of weeks ago, so I haven't got the full book, but I just thought it would give you a flavour of some of the cartoons that we use to try and communicate the very complex science. I'm not going to cover this because Detlef has already gone through the different clinical trials. Although I was just wondering, did you talk about Vonafex or Syntaxville? You didn't, did you? No, okay. So these are 2 other clinical trials that are ongoing in Alport at the moment. This is with a French company, and Caliditas, I mentioned earlier, have just completed a phase 2 trial, and they've got they're considering a phase 3 trial. And that was one of the reasons they were at the workshop, was to discuss and understand whether patients were sufficiently excited about it. And there's some really interesting data coming out of their first trial. This is Kahui, who very kindly wrote up these slides for me, which summarized all the stuff. And Detlef talked about this one. This is hugely exciting because this is progressing. They've just got venture capital money that is actually progressing into the next trial, to a phase 3 trial too. And this is really the first genetic therapy. It is only for nonsense mutations, so it's about 5% of our community that it will be relevant for. These are general trials, so these are some of the protective therapies that people can get involved in. And there was some really exciting stuff happening in China, and we also got Bayer to talk about their more general trials, where they also have got an Alport cohort recruited into the trial. That's Kahui summarised. So I'd just like to thank, all this work comes from many collaborators. And the patient organisations here are critical. There is a very special group that collaborate, which is the young adults. So if any of you have young adults in your families living with Alport syndrome, we encourage them to come to our workshops, because we get them together internationally so that they can create a community. And here's one of them on the left, who acted as a chair, and he interviewed all the others. In fact, one of the fathers of a young adult as well, so that the audience could hear about what it's like to live with Alport syndrome. Also, I'd like to thank our Global Workshop Organising Committee. All these people volunteer their time. And we were talking earlier at lunch about Danica from Croatia. She's been incredible how she comes to all our workshops. There's a couple missing here, Rachel Lennon and Hirofumi Kai. They're 2 of the people who've got the genetic, actual therapies in development. Rachel, a genetic therapy, and Hirofumi Kai has developed an actual molecule which he's testing too. Other members of the workshop organising committee here, Jeff Miner again is just publishing. He's just had agreement to publish something on a gene therapy, which is hugely exciting. Rosa Torra is a very important woman because she heads up the kidney world in Europe, and so to have her on our committee is absolutely vital because she can get us the best people to work on Alport. And then Kahui in Singapore is our leading light with helping with resource-constrained countries. So Kahui, in her holiday time, so she's a children's kidney doctor in Singapore, and in her holidays, she goes to Vietnam and Cambodia to diagnose people living with inherited kidney disease. So she's a very special woman and helped us organise our workshops in Singapore and China. These are all the lovely patients, particularly the young adult patients on the end, who are our leadership team contributing to the workshops. And then this is Alport UK. So this is my fellow trustees who agree that we both, Alport UK is around to work in the UK and support patients in the UK, but also to collaborate internationally on research. And we have an amazing group of volunteers. I'm a volunteer, I don't get paid for what I do. We have just 2 paid people who are wonderful that keep us going. So in summary, I just wanted to say that you should be really proud of the treatments that are being developed. We have a really vibrant research ecosystem, and lovely Franz here on the left, Franz Schaefer, came and presented at our workshop in Beijing, and he's promised to do the next workshop in Europe, which I will do. And it's an open invite to any of you to join the collaboration. So I really encourage you, I've got an email address at the end. Please do come and join us and participate in the workshops because they're really inspirational. And also, by joining in, you also inspire the pharmaceutical companies to do more exciting science as well. I don't think I've got time for the final video, have I? No, I was going to say I'll move on. So just finally, workshop dates for your diaries. September 26th, we've got one in Eastern Europe. I'm just deciding with Franz where it's going to be, but I really encourage you to join that. And then we're heading to Brazil in 27. Thank you very much for listening.
Thank you very much for this comprehensive report from Beijing. So a lot of data, so a lot of projects, but still, okay? Todd?
Thank you very much for that. It was really amazing.